Hello everyone, I am very excited to welcome our today's guest, Dr. Unnikrishnan, one of the leading endocrinologists in the world, has multiple awards to his name, as well as an author, probably more than 200 government medications now.
Yes, thank you.
Welcome Dr. Unnikrishnan on our expert series at Upside Health.
Thank you, it's a pleasure to be here. Thank you for having me on this program.
Absolutely, our pleasure, sir. I think we will straight away get into a few questions that we would like to ask you,
Yes.
which will help our audience understand about diabetes, about metabolic health in general. For the interest of our audience, if you could please simplify what it is, what happens really, and what is this all metabolic syndrome all about?
So, as you know, people call India as one of the capitals of diabetes in the world because we have more than 77 million people with diabetes. Now, when you look at metabolic syndrome, diabetes is only a small part. Metabolic syndrome includes hypertension, which is high blood pressure, obesity, high cholesterol, heart diseases, and diabetes. So, this constellation of all these things are together called the metabolic syndrome. In India or in Indians or South Asians, metabolic syndrome occurs at an earlier age, especially diabetes and heart disease, occurs almost a decade before it happens in other parts of the world. And therefore, it's very important to understand why this is happening. And one of the key things people are talking about as a reason is the presence of abdominal obesity, the presence of fat in the abdominal tissues. That is supposed to somehow lead to this epidemic of type 2 diabetes and heart diseases in South Asia and of course in other parts of the world.
Got it. So another question that comes up very often is that things start with diabetes and there are always associated comorbidities or other conditions. Is that the right thing, or there are so many things happen together, or there is a sequence of how these diseases start to develop for normal people?
Well, we don't know the answer, but there is something very interesting called the ticking clock hypothesis. Okay. The ticking clock hypothesis suggests that while you see the patient when the patient's blood glucose is high,
right,
the process of diabetes and the heart disease risk has started years before the diagnosis. So that is why we talk about prevention of diabetes, people who have pre-diabetes. And now this is for the audience. The world is divided into people with diabetes, people with pre-diabetes, which is a state between normal glucose and diabetes, and normal.
Right.
So people who transit from normal glucose to pre-diabetes, we should prevent them from getting the pre-diabetes, but if you can't do that, you should prevent them from moving into diabetes from pre-diabetes. Right. So therefore, scientists believe that all these processes have started years before the diagnosis of the diabetes. For example, in people talk about the Titanic ship, and they say that the Titanic ship hits an iceberg. Now, an iceberg has a little piece of ice above the sea,
right,
but there's a large mass of ice below the water, and which is actually damaged the ship. So similarly, what you see as the high blood glucose or high blood pressure is only the tip of the iceberg.
Right.
Underneath that, there is this huge metabolic dysfunction going along, and that metabolic dysfunction means we are not just talking about abdominal obesity, we are talking about diabetes, we are talking about hypertension, we are talking about high cholesterol, we are talking about heart diseases. We are also talking about diabetic complications, which means diabetes, if you don't treat it, it affects the retina. People become blind because of that.
Right.
It affects the feet, it affects the kidneys, it affects the heart. In addition to that, obesity itself causes knee pain. People get osteoarthritis of the knee. People snore, they get sleep apnea. Women find it difficult to conceive. They have something called polycystic ovarian disease. So what you see out there may be just a little bit of high blood pressure, high blood pressure. It's not really pleasure, it's really bad thing. And of course, high cholesterol, or people say I have a little bit of diabetes, but that's not the truth. Truth is there's a huge monster of an iceberg which lies below the ocean or the sea.
This is a great analogy of iceberg. And is there an associated signal that we probably experience or see, but maybe continue to ignore? That's why it continues to develop without our proper knowledge until it hits you that you are now a diabetic spectrum. Are there signals that to watch out for normal people?
Yes, of course, there are some signals. One thing is something you can't change. Nobody can change their parents. So that is a genetic signal. If the father and mother have type 2 diabetes, the chance of a child getting type 2 diabetes is very high, maybe
Right.
even more than 70%. If a sibling has type 2 diabetes, then the chance of the other sibling having it is
I see.
also very high. So one is of course family history.
Okay.
Second is abdominal obesity, just measuring the waist. If a gentleman or a lady finds that their waist circumference is increasing, that indicates abdominal fat.
Got it.
Then of course, the very fact that the doctor tells you that yes, your BP is a little high, but we don't need medicine.
Right.
Yes, your glucose is a little high, but you don't need medicine.
Right.
So that means there's something going on, right? So
That's right.
these are some signals. Now these are signals which people can understand and people can apply in their day-to-day practice.
Right.
But research is looking at newer signals, newer markers which could predict
Got it.
these signals which lead to metabolic syndrome, and there are many such biomarkers for
Right.
predicting the disease.
Got it. And also, see, some of the things that it's complicated for sure, but are there situations where it is definitely reversible / avoidable, and there are conditions where it is not, but it is manageable to certain extent? Are there any broad differentiation between two types of situations people may be facing?
Yes, so the concept of type 2 diabetes, about many years back, doctors used to think of type 2 diabetes as a progressive. I mean, it
Right.
has to progress, and you have to not just follow diet, you have to add one pill, and then you have to add two pills, and then you have to add insulin. So people used to say, give up and say, okay, now I need 2 pills, now I need 3 pills, now I need insulin. And the doctors also used to follow that. And this was thought to be the norm.
Right.
But a couple of studies and then more studies came in showing that type 2 diabetes could be a reversible disease.
Okay.
And therefore, people started talking about dietary modification to
Right.
completely reverse. That means you can bring the blood glucose to normal and stop the medication. But then what happened is many patients started so-called reversal diets,
Right.
and their sugars came to normal. But once they relaxed, their blood sugar levels came back.
Very high.
Then the scientific community started saying that we shouldn't be calling this reversal. I mean, this is not the word for it. So they formed a guideline, and very interestingly, they got a cancer specialist also to be on the guideline.
Okay.
The reason is because the word reversal is not the right word.
Okay.
The ideal word is remission.
Remission. Got
Why
it.
is remission important? Because if you use the word remission, somebody's type 2 diabetes has undergone a remission,
Right.
then the patient knows, the doctor also knows that things have become better.
Yeah.
But if the patient relaxes and if the doctor relaxes,
Right.
then it can come back.
Got it.
That you call it as a relapse.
I
So these are very common words in cancer: remission of cancer and relapse of cancer.
Right.
Somebody is, for example, thyroid cancer, which is the commonest and easily curable cancer.
Right.
It gets better. The doctor will tell the patient, your cancer is now in remission.
Right.
Doctor never says your cancer is
It's
reversed.
reversed. Got it.
So that is why they got an oncologist to discuss these terms and put the right terms. So today we say that type 2 diabetes
Right.
is a disease that can completely undergo remission,
Got it.
so that the patient and the doctor know that they have to follow dietary measures, lifestyle measures
Got it.
for the long run.
Got it.
But at the same time, let me tell you that the same dietary measures don't have to be followed all the time.
Right.
Initially, the patient can really go for a significant calorie restriction or carb restriction
Right.
for the first 2 to 3 months,
Right.
and then can be relaxed a little bit, not too much, relaxed a little bit, and that relaxed maintenance diet can be followed for a long
Got it.
time.
Got it.
So this is a new thought process that type 2 diabetes, and you mentioned metabolic dysfunction, which includes high blood glucose,
Right.
blood pressure, cholesterol. Many of these can be completely reversed without medication, but the word is remission.
Remission, not the reversing. That's interesting point, and that's also leads me to a sort of different question, and come back to this point again. There is, as you mentioned, there is a significant rise of diabetes and associated disorders in India and globally as well. And there is a correlation between fixing or remissions can start if you really follow a good lifestyle. So is it safe to say the lifestyle is the biggest culprit in the rise of this type of diseases across the world and also in India? Is that the right thing to say?
I think it's absolutely right, because if you look at type 2 diabetes, only a proportion of type 2 diabetes is because of biological causes or
Right.
genetic causes. Majority, it is because of a suboptimal lifestyle.
Got it.
Excess consumption of sugar sweetened beverages, excess consumption of refined food.
Right.
We call them as junk food, and junk food can be of doesn't mean really the Western food. It can be any food which is sugar rich.
Right.
And exercise, the lack of opportunities to exercise, a lack of time to exercise, lack of awareness of the importance of exercise. And the third factor, the stress of a very modern lifestyle. So these are some of the reasons why diabetes is happening earlier and earlier. This phenomenon has been noted in heart diseases. Some people call it genetic anticipation, where with each generation, the disease comes at an earlier and earlier age. Grandfather got heart disease at the age of 70, the son gets it at 50, the grandson gets it at 40. It's because with each age, the genes may be the same, but physical activity comes down, food becomes unhealthy, life becomes stressful, so you start getting it, people start getting it at younger ages.
Got it. The environment is changing drastically. That's possibly one of the reasons, right?
And many of these people who are so-called type 2 diabetes, if I may say so, they really have been pushed into it by a very abnormal lifestyle. And once they just correct it, they get back into groove and they do well.
Got it. Understood. Okay. So let me summarize this, Dr. Unnikrishnan. The lifestyle, you talked about probably 4 things, just to be clear about that part. One is the food related lifestyle, junk or any sort of high in sugar, high in refined carbohydrate. Number 2 is lack of activity levels or exercise. Number 3 is stress. And urban lifestyle is full of different types of stresses. And number 4, I think you mentioned that, but just want to clarify if I missed that, is the sleep. Does the quality of sleep and the quantity of sleep, is that also another important factor from the lifestyle perspective?
Absolutely. One would link it to stress, but even without stress, the duration of sleep is very important.
Okay.
Because studies have shown that the better the sleep quality, the lower is the risk of metabolic diseases like type 2 diabetes, heart disease, even longevity. And we don't know the reason for that, but it is possible that just like a computer has to, say, reboot itself from time to time, sleep is a time when the brain and the body get time to rest and recover and recuperate and regenerate. That time is very important. And also, today we know that there is something called the biological clock. And the new discovery is that almost every tissue has its own clock.
I see.
For example, if you watch or anybody watches a cricket match and suddenly gets up at night, after watching a cricket match, you get up from your seat, you open the refrigerator, you eat a pastry. Now, the thing is, once you have eaten the pastry, the brain has been constantly telling you it is night, go to sleep, go to sleep, go to sleep, because the brain is driven by the light signals that the eye gets.
Got it.
But the tummy is telling you that it's daytime, you've just eaten. So there is a dichotomy between the signal of the brain and the signal of the gut. And this dichotomy is one of the things, curiously, which drives to type 2 diabetes, obesity and cardiovascular disease. We don't know the mechanisms, but this connection has been shown for a very long time now.
Very interesting. And this, of course, this doesn't happen overnight, but if this process happens repeatedly in individuals' day-to-day lifestyle, the propensity of developing these diseases are far higher. And as you said, it is reducing the time it takes to get to these diseases, is what you are saying, right?
Absolutely.
Excellent. I think one more point I wanted to ask you, and this is for the people who are aware of these problems, but unfortunately have caught those diseases, but they understand the remission is possible. And in today's world of healthcare, patient-centric healthcare, how is it? What do you normally do to empower users patients to take control of their health in their hands?
See, today the good thing is that because of the glut of information, I think diabetes and management of many diseases is actually a collaboration between doctor and patient. In fact, if you see, many diseases are going towards the patients, and diabetes is one of them. And therefore, because today patients are aware of, say, carbs and fat and different diets, so it's easier to talk to them and reach a collaborative plan. And today the treatment of any disease, including diabetes, is number 1, the scientific evidence, number 2, the patient's choices, number 3, the doctor's experience. So
Right.
all these things together come, and we
comes,
have to respect patients' choices.
Right.
And today, if you look at type 2 diabetes, both doctors and patients are aware that
Right.
there is a possibility of managing these diseases to a significant extent, if not fully,
Right.
with lifestyle. And that's something which is the need of the hour. And fortunately, I think that time has come now that many metabolic diseases are becoming a collaboration between
Excellent.
the healthcare providers and the patients, and that's a good thing for
That's a
everybody.
good thing for everybody, absolutely. And ultimately, as you said, it keeps relapsing unless you fix your day-to-day lifestyle permanently, right?
Absolutely.
So that brings to my last question to you, Dr. Unnikrishnan. If you need to give some, I wouldn't call it tips, is a very small word, but if there are 4 or 5 major guidelines that you want to tell people at large, if they want to avoid getting into this spectrum of diseases, what are those 4 or 5 main things that you would suggest people to follow from a preventive standpoint?
Well, there was a very famous English writer called Mark Twain.
Right.
And Mark Twain said that the only way to remain healthy is to eat what you don't like, which he said is probably fruits and vegetables.
Right.
Drink what you don't like, which probably means water.
Water.
And do what you would rather not do,
Exercise.
which means exercise. But that was years ago, decades ago.
Right.
Today, all these things have been solved thanks to modern life and technology. Today, if you don't want to eat fruits and vegetables, there are so many other dietary choices which are still healthy.
Right.
If you don't want to drink water, you can drink, say, coconut water or Karela juice. You have a lot of things to offer. Similarly, if you don't want to do exercise for the sake of exercise, you can play badminton or go for a run.
Right.
So, therefore, diet, exercise, reducing the stress,
Right.
improving the sleep, and of course adequate hydration.
I
These
see.
are very important. And if anybody has diabetes, then monitoring their blood glucose so that things don't go out of hand is also
Got it.
very important.
Got it.
See, we as doctors know that type 2 diabetes is a lifestyle disease.
Right.
But the truth is, not everybody can be controlled by lifestyle. There will be a small proportion of patients
Right.
with diabetes where there may be a biological reason, and that if you allow the glucose to progress, then the patient might be in trouble. So it's important to identify that
Those
subgroup.
situations.
But for the vast majority, I think following all these good things,
Excellent.
following a good diet, physical activities, sleeping on time, reducing stress, drinking enough water, and also spending time with family, having friends, having a social life, I think avoiding loneliness, I think all these are also very important in modern life. Once all these are taken care of, I think then people have a good chance of living longer and longer, and that's probably the next goal. Because
Absolutely.
metabolism is one goal, sugar is one goal, BP is one goal,
Right.
cholesterol is one goal, but the ultimate goal is to improve the longevity, and
Right.
these are little incremental steps which will build that path.
Excellent. Healthier longevity, as we
Yes.
call it, right? Absolutely. Just to summarize, sleep, stress are the 2 important things. Good food, good level of activities, and 2 new things that I learned today, which is hydration, of course, is important part, and the social connections that you want to have in life.
Absolutely.
Excellent. Thank you very much, Dr. Unnikrishnan, for your time today. I'm sure our audience is going to learn a lot. Thank you very much again.
Thank you, Mr. Vyas and team, and it has been a pleasure to be on your program.
Thank you very much, sir. Thank you.